for joining us for another edition of Thursday Thoughts. Today, this is Dr. Garrett Weegriff here at Pure Plastic Surgery, and we are going to be going over breast implant removal or breast implant explantation. And we'll go over the reasons why some people are having this done, and what are your options for after you do this, and how we sometimes stage these procedures for different people based on a few different circumstances. So one is, why are people having their breast implants removed? And it can be for a few reasons. It can be just an aesthetic choice. You know, trends kind of fall in and out of favor, and some people are just going back to a more natural look, and that can be the reason they're choosing to do this. Another reason could be breast implant illness, which is a topic we've talked about a few times, and it's a very nuanced topic that I'm not going to get into completely at this moment, but some people have some type of a reaction to having their implants. That being said, the vast majority of people that have breast implants do not suffer from this issue, and we have not been able to scientifically correlate any single medical identifiable, testable issue to breast implant illness, but there are some patients that get relief from having their implants removed. So this is another reason why some patients are getting their implants removed. And then we're going to talk about what you should do. Obviously, if we just remove an implant, there can be quite a few ramifications about the aesthetic of how your breast is going to look when doing that. So the first thing that we think about whenever we're talking about removing an implant is, one, the age of the patient and how long they've had those implants. Because if this is a young patient that's only had the implants for a short period of time, their bodies have more ability to contract their tissues back into a more natural looking appearance, almost to before when they had their implants. And obviously a few considerations go into this, like your skin quality, if you've had massive weight loss in the past, but a normal, young, healthy person that doesn't have a lot of stretch marks and they didn't have huge implants, it's very possible we can just remove your implants and your tissues will kind of just shrink down back to their more normal size. And we probably won't even think about doing a lift unless you were borderline needing a lift before getting your implants. We also need to think about how much breast tissue you had. If you started with, virtually no breasts at all and then had an augmentation and it made them significantly larger, you're gonna have a lot more loose skin that's probably not gonna contract all the way. And so one of the other things we can think about is what type of implants you had. And so the vast majority of patients nowadays are getting silicone implants, but for a lot of patients that had saline implants, one of the options we can do for you, just to get a sense of what it would look like without your implants, I can actually rupture your saline implants. This is different than silicone, but your saline implants, we can just poke a little needle in it in the office, let those implants deflate over a few days, and you can get a sense of what it would look like to not have your implants in, and we can have more of a discussion about how to proceed when we remove the remaining capsule, if we need to do a lift or something else. Also, that gives your body an opportunity to shrink its tissue again. And if we pop it and let it go for a few months and you're happy with how it looks, it's a very simple procedure where we just make a small incision and we're able to pull out the capsule of those saline implants. Again, this does not apply to silicone implants, because if we rupture those with the needle, they're just going to maintain their shape, and because that silicone doesn't go anywhere. And then we have to think about, for the patients that have had implants for a very long time, and if you're a little bit older, maybe over 40 or 50, what are we going to do after we remove those implants? And sometimes we like to stage this procedure to let things contract back down, and then we may need to proceed with something like a breast lift. Another one of the options we have, if you just want to get the foreign body out of your, get the implant out of your body, we can do that. We can let things contract back down over a few months. We can come back and we can offer you fat grafting as one of the adjunct procedures to help get you the appearance of the breast that you're looking for. Again, fat grafting is always going to lead to a more natural appearing breast, because it's never going to be able to give the structure that an implant does, but it can restore volume. Oftentimes it needs to be done over several settings or several different surgeries to get the maximum effect, because overall when we graft fat to the breast, only about 50% of it survives long term. So sometimes we have to do it 2 or 3 times. I know that's a lot of information to cover in a short period, and I'll have another discussion about breast implant illness. I think we had one a few months ago, but it's a worthwhile topic to go over, and we'll do that in coming weeks. But do I have any questions regarding breast implant removal?
Well, the question is in Spanish, so I'm gonna translate it for you. You answer in English, and I will translate to Spanish because she's connected. Okay? Es muy doloroso una cirugía de senos. So, is it painful to have breast surgery?
So different breast surgeries have different levels of pain, and actually most breast surgeries are very well tolerated. Breast reductions, breast lifts, very well tolerated. Even breast augmentation is very well tolerated. The one thing that can be a little uncomfortable is when we do a breast augmentation and it's underneath the muscle. The tightness of that muscle is a little uncomfortable for a few days, but overall breast surgery is very well tolerated.
En resumen, el doctor dice que la cirugía de senos, el dolor es bastante tolerable, que puede que cuando ponen un implante debajo del músculo es cuando sea un poco más doloroso, pero que básicamente son cirugías que los pacientes toleran muy bien.
Yeah.
Okay, and how soon after one surgery you can have another one?
Well, that depends what we're talking about, but if you're talking about how soon after a tummy tuck and you have a BBL or something like that, we usually say wait about 6 months in between surgeries. If we're going back to operate on the same area, like it was a breast surgery and we're going to do another breast surgery, I really like to wait closer to the 6-month mark.
Okay, Doc, for prices and consultation, I know you have to go to the
Yes.
OR,
So please go to pureplasticsurgery.com if you're interested in a consultation or if you have any further questions, and I look forward to seeing everybody next week for Thursday Thoughts. Have a great day.
Okay, y en español lo preguntaron, los precios de la cirugía. Si quieren saber los precios, visiten www.pureplasticsurgery.com, dejan sus datos y una coordinadora los va a llamar y les va a dar los precios según su procedimiento. Ahora sí, bye. Thank you, Doc.